In an age before anesthesia, antiseptics or antibiotics, a visit to the doctor was not a path to healing, but a preamble to torture. To fall ill in the medieval world was to enter a theatre of pain where the cure was often far deadlier than the disease itself. Over the next few minutes, we will examine the grim reality of medical practice between the fall of Rome and the Renaissance. This is not merely a story of historical ignorance, but of deeply held, deeply flawed theories that led to centuries of unnecessary human suffering. We will step inside the reeking chambers where barber surgeons performed unthinkable acts in the name of health. The medieval mind saw the human body not as a biological machine, but as a battleground of spiritual and elemental forces defined by ancient texts. Medicine was heavily reliant on Greek and Roman authorities, distorted through centuries of translation and rigid church dogma. Sickness was frequently viewed not just as a physical ailment, but as divine punishment for sin, meaning the physician's blade was often secondary to prayer and repentance. The average person lived in a world defined by filth, severe malnutrition, and the constant looming presence of death, making their desperate reliance on horrifying remedies understandable, if not tragic. The absolute cornerstone of medieval medical theory was the concept of the four humours. Inherited from antiquity and cemented by Galen, it dictated that all health was a delicate balance of four vital fluids: blood, phlegm, yellow bile, and black bile. Illness was interpreted merely as an imbalance of these fluids. To restore order, the most common and devastating method used for over 1,000 years was phlebotomy, bloodletting. Physicians fervently believed that drawing copious amounts of blood would purge the body of corrupt or excessive humours. It was the universal answer, used for everything from mild headaches to smallpox. Imagine suffering from a high fever, already weak and delirious, only to have a barber surgeon slice open a vein in your arm or neck, draining pint after vital pint until you fainted from shock. They also heavily utilized leeches, sometimes applying dozens at a time to suck away the bad blood, leaving the patient severely anemic and vulnerable to infection. It was a systematic weakening of the body precisely when it needed its strength the most to fight infection. During this era, actual surgery was rarely performed by university-trained physicians who considered the manual labor of cutting into flesh beneath their intellectual dignity. This grisly work fell to the lower class of barber surgeons. These were men who wielded straight razors to cut hair and slice human flesh with equal indifference. The most critical element of medieval surgery was the complete absence of effective anesthesia. A patient needing an amputation due to a crushed limb or gangrene would be held down by strong assistants, or strapped tightly to a wooden table. The surgeon would use a curved knife to slice rapidly through muscle and skin, followed by a heavy bone saw to rasp through the femur or humerus, while the patient remained fully conscious, screaming in unimaginable agony. To stop the massive bleeding, the raw exposed stump was cauterized, seared with a red-hot iron plate or boiling oil. The shock of the pain alone frequently killed the patient on the table. Those who managed to survive the initial trauma often succumbed days later to the inevitable massive infections that followed in non-sterile environments, as pus was considered a sign of healing rather than danger. For issues concerning the head, such as epilepsy, severe migraines, or mental instability, conditions often characterized as demonic possession or a buildup of vapid humours, the ultimate remedy was trepanation. This involved drilling a hole directly into the living human skull. The prevailing theory was that this opening would allow evil spirits or excess pressure to physically escape the brain cavity. Working again completely without anesthetic, The operator would use a hand-cranked drill or a small hammer and chisel to slowly bore through the thick bone, eventually exposing the pulsating dura mater of the brain underneath. Archaeological evidence shows skulls from this period with multiple healed holes, indicating some poor souls survived this agonizing procedure more than once. The sensory experience of hearing and feeling a metal drill grinding through one's own skull bone is horrifying to contemplate. It was a desperate measure that frequently resulted in severe brain damage, fatal meningitis, or immediate death from uncontrollable hemorrhage. When the Yersinia pestis bacteria arrived in Europe in the year 1347, it encountered a medical community utterly unequipped for the apocalypse. Physicians, paralyzed by the scale of the dying, turned to desperate and bizarre measures to combat the Black Death. One common practice was the lancing of buboes, the agonizing swollen lymph nodes that appeared in the groin and armpits. These were sliced open and packed with a mixture of tree resin, human excrement, and dried lilies. This did nothing to stop the infection, and likely introduced even more lethal bacteria into the bloodstream. Others suggested that the plague was caused by miasma, or bad air, leading to the development of the iconic plague doctor costume. These figures wore long leather robes coated in wax and masks with long bird-like beaks stuffed with aromatic herbs such as camphor, dried roses, and cloves. They believed that if they could only smell the sweetness of the herbs, the death air could not reach them. In reality, the leather acted as a primitive biohazard suit against flea bites. Though the doctors themselves remained terrifying harbingers of the end, walking through streets where 60% of the population was being cleared away in carts. If the surgeon's blade did not kill you, the apothecary's jars might finish the job. Medieval pharmacology was a chaotic blend of superstition, alchemy, and sympathetic magic. One common remedy for the falling sickness, or epilepsy, involved drinking water from the skull of a recently executed criminal or consuming powdered human bone. This was known as corpse medicine, and it was based on the belief that the vitality of the deceased could be transferred to the living. For those suffering from skin diseases or gout, physicians often prescribed ointments made from the fat of boiled dogs or the gallbladders of eels. Mercury was also a favorite ingredient, applied topically or ingested for various ailments, slowly poisoning the patient and causing their teeth to fall out and their nervous system to collapse. In the year 1185, records describe treatments for respiratory issues that included swallowing live young frogs to clear the throat. These remedies were not seen as primitive. They were the cutting-edge science of their day, practiced by the most educated men in society. For a medieval woman, the most dangerous moment of her life was the act of giving birth. Without an understanding of germ theory, the risk of puerperal fever, a massive uterine infection, was nearly universal if the birth was complicated. Midwives, while often more practical than male physicians, relied heavily on religious relics and charms. A woman in difficult labor might be wrapped in the girdle of the Virgin Mary, or have a heavy parchment with holy verses laid upon her stomach. If the child was stuck, the methods became truly horrific. Medieval obstetrics often involved the use of sharp hooks and crochets to forcibly remove a fetus that had died in the womb to save the mother's life. In many cases, both mother and child perished in a haze of blood and exhaustion. It is estimated that in some regions, 1 out of every 3 women died during their childbearing years, a statistic that reflects the absolute helplessness of medieval medicine when faced with the most natural of biological processes. One of the most terrifying invisible illnesses of the Middle Ages was ergotism, known then as St. Anthony's Fire. Entire villages would suddenly descend into madness, suffering from vivid, terrifying hallucinations and a sensation of their limbs being consumed by invisible flames. This was caused by a fungus that grew on rye bread during damp summers. The medieval diagnosis was not a fungal infection, but a spiritual one, divine wrath or a curse. As the disease progressed, the vasoconstriction caused by the fungus would lead to dry gangrene. Fingers, toes, and eventually entire limbs would turn black, shrivel, and simply drop off without bleeding, often while the victim was still alive and raving. The only cure was a pilgrimage to the shrine of St. Anthony, where the change in diet, away from the tainted rye of their home village, often led to a miraculous recovery. Thousands of people lived as limbless beggars, a living testament to the era's complete lack of understanding regarding the food they consumed every day. In an age before stitches were commonly understood as a way to close deep wounds, the iron's kiss was the standard of care. Cauterization was the practice of using white-hot metal to sear flesh shut. This was used to treat everything from sword wounds to hemorrhoids. The theory was that fire was a purifying element that would seal the humours and prevent the putrefaction of the flesh. In the year 1250, a surgeon might describe the process of treating a deep ulcer by pressing a glowing iron rod directly into the wound until the smell of burning hair and meat filled the room. The pain would be so intense that patients would frequently suffer cardiac arrest or permanent psychological trauma. While the heat did technically kill bacteria and stop immediate bleeding, it left behind massive areas of dead, charred tissue that were highly susceptible to secondary infections, often leading to the very rot the surgeon had hoped to prevent. Perhaps most harrowing of all was the medieval treatment for cataracts, a procedure known as couching. A physician or a traveling charlatan would take a sharp, thick needle and without any form of numbing agent, thrust it directly into the patient's eyeball. The goal was to push the clouded lens down and away from the pupil into the rear of the eye. If the procedure was successful, the patient would see a sudden, blurry world of light and color, which was hailed as a miracle. However, because the needle was never cleaned, the interior of the eye would almost inevitably become infected. Within days, the eye would swell with pus, and the patient would lose their sight forever, often suffering through weeks of agonizing pressure and inflammation before the eye socket eventually withered or the infection spread to the brain. This was the standard ophthalmic surgery for over 800 years, performed in marketplaces and village squares across the continent. Looking back through the long lens of history, it is easy to view medieval medicine as a collection of barbaric follies. Yet these practitioners were not monsters. They were men and women operating at the absolute limit of their understanding, trying to bring order to a world of chaos and pain. Their failures remind us of the fragility of the human condition and the terrifying cost of ignorance. We inhabit a world built upon the lessons learned from their screams. The history of medicine is not a straight line of progress, but a dark, winding path through a valley of shadows, where every breakthrough was paid for in the currency of human agony. As we move forward, we must wonder which of our modern cures will one day be looked upon with the same shiver of horror that we feel for the barber surgeon's blade.